afternoon. My name is Jenna Webb, and I'll be the moderator for the call this afternoon. With us in the room is our CEO, Scott Livingstone, and we do have a number of individuals on the line as well, but to make introductions, I'll turn it over to Scott.
Thanks, Jenna. Good afternoon, everyone. On the line with me today is Dr. Susan Shaw, the Chief Medical Health Officer, Dr. Julie Kryzanowski, our Senior Medical Health Officer, Mr. Derek Miller, our Commander of the Emergency Operations Center, Dr. Zayed, our Northern Medical Health Officer, and Dr. Saqib Shahab, the Provincial Chief Medical Health Officer, is also with us today. Before I start, I'd like to once again thank all healthcare workers across this province for the work that they do every single day to take care of Saskatchewan residents. And to that end, I also want to thank everyone in Saskatchewan for the work that they are doing to help support our COVID-19 response. As we can see from our relatively low case numbers, what you're doing is working. We just need now your patience and your perseverance going forward. Since last week, we've continued to aggressively strengthen the offensive plan and strategy for COVID-19 response. We continue to enhance protections around some of our most vulnerable populations. Specifically, we've been watching and learning across the globe about how deadly the impact is of COVID-19 on patients in long-term care. Working closely with the Ministry of Health, we are taking the directives outlined in Friday's public health order and moving rapidly to enhance protections, many of which we've already put in place to protect these individuals. Going back to April 3rd, we had put in place daily fitness for work screening for healthcare workers and anyone entering long-term care facilities. This measure is already helping to protect our patients, residents, and healthcare workers. This we built on next, the visitor restrictions to minimize the risk of virus entering our facilities and our long-term care residents. But we know we need to continue to do more to enhance these protections. Prior to the public health order that was issued last Friday by the province, we had already started the creation of a strategy to limit the number of staff working in multiple facilities. We know we need to do this to limit the opportunities for vulnerable people to be exposed to this virus. The health and safety of our employees is the utmost importance, and keeping people we serve healthy and safe is paramount to the work we do each and every single day. The order restricts the movement of staff among long-term care and private care homes by ensuring each staff member works only in one facility. This strategy is known as cohorting. This approach has been implemented for other outbreaks in Saskatchewan, such as influenza, and is one that we're familiar with. But staff cohorting has never been done on a provincial basis, and this will be our first. With such a large and varied workforce, spread over such a sizable geography, and services normally dependent on coordinating staff between multiple sites, achieving this will be no small feat. Late last week, we reached a letter of understanding with our union partners to ensure a collaborative approach to this process. I'd like to personally thank our union partners for working with us and providing such strong leadership in these uncertain times. We are all committed to putting the safety of our clients, residents, and healthcare workers first. Because of our joint efforts, I'm pleased to say that we are on track to ensure everything will be in place by April 28th to meet the requirements of the public health order. These measures will build on the protections we put in place early last week with the introduction of universal screening and continuous masking across all of our facilities. We've also established an occupational health and safety hotline and an email address for our physicians and healthcare staff to flag or rapidly access information on the safety and supply of protective equipment related to COVID-19. We also continue to expand our testing sites with a focus first on testing new technologies that will enhance the speed of our contact tracing. We're exploring pilot projects with new technology on temperature screening that will support procedures that we put in place last week to help mitigate any delays in getting our healthcare workers to the units, to their patients, clients, and residents. You can imagine that these are not simple or easy measures, but these measures are needed and necessary, and we are making every effort to put them in place as soon as possible. Like everyone else, we've been watching the numbers every day, and we are optimistic that they will remain low. As you heard yesterday in the press conference with Dr. Shahab, we have lowered the RT, or the spread of the disease from individuals, to under 1. This is good news, and while we know that the most important variable for keeping our numbers low is public adherence to the various restrictions in place, we also want to highlight that Provincial access to testing throughout our province and strong performance on contact tracing have also played a significant role in flattening the curve here in Saskatchewan. While our COVID readiness plan presented to you earlier this month remains as is, we're also building new models to see if our worst case scenario has shifted. Next week, we will share with you more of what we are learning and what we may be adjusting in our response plan, both offense and defense, as a result of those new numbers. For now, what I will say, though, is that we are still planning for the worst. We are still planning for extraordinary demand on our critical care units, healthcare teams, and working hard to ensure that we have the necessary acute care capacity to deal with COVID-19 surge. Our hope is that one day we can report back and say this extra capacity we are building was never used for COVID, but is being used for us to recover the system back to where it was pre-COVID. This would mean that the preventative measures set by the Government of Saskatchewan for all residents have been successful. It would also mean that our efforts on testing and contact tracing continue to be successful. Obviously, our job is to be there when you need us, so we will continue to move forward with expanding our acute care capacity needs regardless of what scenario we face. Please stay vigilant so that we can avoid the worst case scenario. We recognize this involves your sacrifice, and we thank you for your efforts. We'd be happy to take questions now.
Great. We'll start with questions today in the room.
Yeah, sure. Can you provide a bit of an update on the long-term care home situation in terms of infections? Where are we seeing these outbreaks? How many folks are infected?
Sure.
I don't know who wants to take that one.
Julie, are you okay with answering that one? The question was around long-term care outbreaks.
Yeah. So with respect to reporting and monitoring long-term care outbreaks, that is something that is tracked and reported on. And we work very closely together with our colleagues across the health system in Saskatchewan, so facilities owned and operated by the SHA. But we also are working with the Ministry of Health to be reporting out on this information through an integrated EPI report. We can follow up with you about the specifics that's included in that report.
I guess as a follow-up, you know, we're going to be seeing a plan this week to perhaps start lifting some of the restrictions, allow some businesses to start opening. We're told that testing capacity is kind of key to making this work, that we don't see a second spike, but we're seeing testing numbers go down. So how are we supposed to be ramping up our testing efforts when the actual number of tests done are decreasing?
Oh, it's a great question, and I'll start, and then I'm going to turn it back over to Julie. So you'll recall that the Premier committed to a 1,500 a day, testing capacity, and we have been at that capacity. Actually, we have the ability to test much more than 1,500 residents a day. As you know, our testing strategy has focused on symptomatic people, and we opened up our criteria to virtually anybody with a single symptom early on in this. Why our testing numbers are dropped is we're just not seeing people show up with symptoms of COVID-19. We're also seeing, in some cases, a drop in the number of calls to 811 in other areas. That doesn't mean we don't have the ability to test more. We're just not seeing those patients. There is work being done by Dr. Kryzanowski and Dr. Shahab on a strategy to increase testing that goes beyond the testing of symptomatic people and asymptomatic folks that have been in contact with COVID, particularly healthcare workers and long-term care residents. But I'll ask Julie to add to that with respect to what the longer-term testing strategy is. The last comment I will make just before Julie does is we have a number of sites that do COVID testing in the province. Currently, we have 4, Meadow Lake, PA, Saskatoon, and Regina. We're going to continue to expand that testing, so you're going to see many more testing sites across the province, because it's not just about testing today. It's about what is our testing capacity going to be like as we continue to monitor and approach our COVID response. But I'll turn it over to Julie.
Yeah, I'd like to, I think, reiterate that in Saskatchewan, we do have the capacity to be testing at numbers of 1,000 or 1,500 tests a day, and indeed that's what we're working towards. I will also point out that among Canadian provinces, Saskatchewan has among the highest testing rates compared to other provinces, second only to Alberta. So we are testing at very high rates per capita. And of the tests, testing criteria, we also have among the least restrictive testing criteria. So testing is available and in fact recommended for anybody with any symptoms of COVID-19. So we do encourage anyone with symptoms to call 811 and seek a referral to a testing center. So with the epidemiology of testing in the province, while we have seen variation in the numbers of tests performed each day, we also know that there are some reasons that I think are decreasing the interest in testing. So in part, we are not seeing high rates of transmission of COVID-19 or other respiratory illness in the province, including seasonal influenza. So the seasonal influenza season is now over. Because of that decreasing circulation of respiratory viruses, people are probably less likely to be interested in being tested. But we're also seeking out all opportunities to be promoting the testing sites that are available and open to the people of Saskatchewan, and encourage people to get tested through a referral through 811.
Why don't we go to a question on the line now? Is there a question?
We have Zach Becerra with the Star Phoenix.
Hi there, can you folks hear me?
Yes, we can.
Wonderful. I would like to ask, in regards to long-term care staff, how is compensation being handled for part-time long-term care workers who might have previously split their time between multiple facilities or jobs?
That's a good question, Zach. Derek, do you have an answer to that with respect to the work we're doing on cohorting and the agreement that we've made with the unions?
Yeah, I can provide some context to that. So as we cohort staff within long-term care sites, we are working to one, give them the opportunity to indicate a preference on which site they might work in. And that could be within long-term care, or it could be other within the health system, or it could be private personal care homes or private affiliated organizations. And we are working with them to ensure that there's, in terms of their pay, that they're at no disadvantage based on where they end up working through the cohorting strategy compared to what they would have received prior to that. So that is an important part of our cohorting rollout over the next week or so.
Is there another question on the line?
We have Callie Stefano with CTV.
Hi, it's Callie with CTV. When it comes to care homes, we just had 2 residents at Eden Care test negative, thankfully. But how difficult is this for the province to ensure that staff members who do leave? I know there is being testing done when they come home, but staff members are being healthy when they come back to work, because we do know seniors are at the most high risk. So I guess, is there anything else that SAHA wants to see be done to ensure that COVID stays out of our care facilities?
Well, I think the obvious answer is yes, and that's why we're announcing some of the new changes today, in particular about implementing the one facility per staff member and all the other things that we've done. We will continue to ensure that our testing is aligned with our strategy around our most vulnerable. It's one of the areas that I know that the testing group is looking at is, are there ways we can enhance the safety for long-term care and personal care home residents by changing up our testing to do either more testing of asymptomatic folks. But right now, it is quite broad. Julie, do you have anything to add around that?
Yeah, I would add that in terms of a population health promotion strategy for this particular population, seniors who, whether they live in long-term care or in the community, are often socially isolated. That's something that is also a consideration as part of our strategy to address the needs of this particular vulnerable population. We are promoting messaging that physical distancing is important, but that social connection is also important. So thinking about what strategies can be promoted either through the staff who work in long-term care and will be cohorted in those facilities to care for that population, but other ways that seniors can continue to connect with their family and loved ones, including through virtual technologies, is something the SHA is also exploring and promoting.
Can we take another question on the line, please?
We have Alicia Bridges with CBC.
Hi, my first question is in regards to La Loche. I'm just hoping you can provide an update on the situation there and explain a little bit more about why it was considered an outbreak and if it still is.
Sure. I'll turn that question over to Dr. Zayed.
So for Lalash, the situation was that we had a case with diagnosed as positive, and that's followed by a contact tracing. The contact tracing was revealed that there is a long-term care patient who was diagnosed with a positive case. So in that context, the definition of an outbreak for long-term care means that one resident or one staff is diagnosed with a COVID-19. So with that context, it was declared as an outbreak in the long-term care. So in the situation for the Losh, the first case was linked to the Curl Lake outbreak in Alberta, and we did the contact tracing. And the cases were linked to a healthcare also from a worker in that place to a healthcare worker, and then the long-term care facility. And our contact tracing revealed other cases. The total cases were 5 cases from the Losh, and we are still the contact tracing is still ongoing. But that's why the situation in the long-term care was considered an outbreak. For the community, we are still doing the contact tracing, and the other cases that came after that also was linked to that Curl Lake. So what we did after that we had a precautionary advisory, and the precautionary advisory was in discussion with the community leadership. So this is to ban or encourage to decrease the non-essential travel between the northern Alberta and the Losh or the northern communities. Also to everyone who's coming from northern Alberta would go into self-isolation for 14 days. And this precautionary advisory is a recommendation that was also discussed with the community leadership in the northern community. And we are in continuous communication and discussion with them. For every case diagnosed within this contact tracing, we are having usually discussion with the leadership, and we have some plans in the community. And it is very encouraging and really thrilling to see this kind of communication and discussion and the translation of the plans into the community. So the situation is under control, and there is also a continuous communication with the community.
Thank you. Let's go to the next question, please, on the line.
We have Lisa Schick with CJME.
Hi, my question is about modeling. It's been a few weeks since you kind of presented the modeling that you had to the province. Is there any new modeling? Will new modeling be done? And it would appear that the first one was quite high for what we're seeing now. I guess, how do you explain that the modeling and that we saw was quite high, but we're seeing very low numbers now?
Okay. So as I said in my opening remarks, we will be presenting the new modeling data next week. We did get a snapshot of the modeling this week and have sent our team back to do some more work so that we can use the models both to talk about what the new models look like with respect to where we are on the curve. And as I said today, we And Dr. Shahab had mentioned yesterday the new R0, or it's now the RT, the effective rate of spread, is under 1. That is a good news story. It means that we are looking like we are for sure flattening the curve, and the restrictions that are in place, as well as the other offensive strategies that we are taking as an SHA, are working. We also know, however, from the modeling data, is if you pulled everything away, we would very quickly go back up to our original projected numbers. So we will providing more detail next week, including how that new modeling may change our response, both in particular our defensive strategy on how much capacity we build. It's important to know that even though our numbers are looking good, they're looking good because of everything that's in place. And as we move forward, things are still going to have to be in place to protect our community. But one of the things that's the advantage of the new modeling is, one, it includes much more Saskatchewan-based data, including what our rate of spread is. That's through our aggressive contact tracing, and we know where we've been breaking the chain of infection and how well that's working. Our broad testing, the restrictions that are in place, but also the fact that we've been incorporating Saskatchewan-based data. The reason they would be different, as you know, from our first modeling discussions, is we were using the rate of spread and data from other jurisdictions globally. We weren't using as much Saskatchewan-based data, but our data is much more refined, and next week we'll be presenting it and talking about how it will change the course of our response. Julie, do you have anything to add, or sorry?
No, I don't think I have anything to add to that, but we continue to refine the models based on the best data that we have, which includes the evidence and epidemiology of what's happening in terms of person, place, and time of the spread of COVID-19 in Saskatchewan. So we will continue to do that going forward, and our planning will be based on that Saskatchewan-specific data.
There's another question in the room.
I'd like to hear more details on the long-term strategy for testing. What specifically is in there, and how are you going to ensure that people are going to get tested, even if they're not voluntarily seeking to do so, by calling 811 or presenting a cough or something to their doctor, because that seems that that's kind of been the criteria now.
Okay. So I'll answer the first question first. So with respect to the strategy, part of what Derek's team with Julie and Dr. Shaw and Dr. Shahab had been involved in is projecting what our testing requirements might look like 7 months out, including if we had a surge in COVID cases or if we continue to have this flattening of the curve. The importance of having testing throughout the province and expanding the number of test sites. So we hope to go to at least, I think it's 15 or 16 test sites for COVID-19, and the already aggressive and expanded capacity we have in contact tracing will be critical for us, not only to ensure that we're jumping on outbreaks or cases as they continue to come, even though we flatten the curve, but also to understand it will be that work that tells us if as we lift restrictions, what we may have lifted too quickly, because we'll be able to see those cases come up. So the model is very dynamic, and we'll be able to use it to help support some of the decisions that may be made with respect to the phasing in of a reduction of the restrictions. With respect to, I think Julie touched a little bit on this with respect to how we're communicating to seniors around the importance of physical distancing. I think you'll see a lot more work that we'll be doing over the long term about helping support people to coming in for testing that may not feel like coming in for testing, but the reality is right now we're dependent upon people to be identifying themselves with symptoms, or we are identifying people that are in close contacts with cases and and sending them for testing. But I'd ask Julie or Susan to weigh in on if we have any other sort of organized strategies around how we might do that.
So with respect to a testing strategy, and we'll certainly provide more updates as this strategy is developed, but based on the planning to date, has 3 prongs. So one is a retrospective look back of how we've organized the availability of testing through testing sites and assessment centers across the province and referrals through 811, making sure that we are addressing any barriers that exist within that process that are preventing people from using the pathways that exist. A second piece is looking forward and what we might be doing differently or doing more of, which includes outreach and use of expanded ways of offering testing that are already in place, but perhaps not everywhere in the province. So using outreach workers or home care workers to be facilitating testing in people's homes would be something to be explored. And then the third prong of that strategy is communication. So both to public, so that they are aware of all of the testing that is available and the routes to get tested if it's indicated, but then also to the providers so that they know how to order tests for their patients and there's ready access when it's indicated.
Can we go back to the line for another question, please?
We have Dan Jones with MBC.
Yeah, good afternoon. I'm wondering, can you please elaborate on what you mean by that the outbreak in La Loche is under control? What specific measures have you done inside the long-term care facility to address that? Can you also address the testing, the level of testing that is being done in that community, and what further precautions or restrictive measures could be coming to the north and La Loche particularly, please?
Okay. Dr. Zayed, would you like to answer that question?
Once an outbreak is the long-term care outbreak was declared, the specific measures regarding this, the control, establishing control measures have been established in the immediately. Putting the patients are on contact droplet isolation plus, and there are specific guidelines for the isolation precautions. All the contact tracing has been done immediately in terms of the healthcare workers who are in contact or close contact with the index case. So they are being home isolated and they have been immediately tested, and all the residents have been tested. Contact tracing is a vigorous process and has been, when I say under control, it doesn't mean that we will not have. It doesn't mean that we will not have new cases. We would have cases, but this means that we trace the link of and we know the link between cases, and we trace the source. So what is important for us and kind of relieving is to know the source, and then whenever any case that can come positive during our contact tracing, it is within, like we find them, they are already on home isolation. So it is just a matter of time, but none of the cases that have been diagnosed afterwards in the community has not been traced and has not been linked, and the link was properly mapped. So that's what I meant about under control. Again, I emphasize it doesn't mean that we will not get new cases, but they are in the link that we already determined. For the outbreak itself in the healthcare facility, there is specific measures that have been outlined by Saskatchewan Health Authority from the beginning of the COVID-19, and there is a Saskatchewan manual, a communicable disease manual, where there are specific guidelines we follow. There is daily monitoring of the patient's symptoms, even if the patients are like the long-term care and they are, for example, non-verbal patients. We have some monitoring criteria to see to monitor their change of the status, and also for the environmental cleaning or environmental disinfection that is done appropriate to the viral infection is done twice daily, and we have this daily meeting for debrief. And staff also are cohorted to work in the long-term care only. So this is all the measures that I meant about control measures.
Thank you. I think we have time for one last question on the line, please.
We have Roberta Bell with Global.
With reference to the situation in long-term care homes, could we get an update on the situation in the Eden care communities in Regina? That another second staff member had been positive and some residents were on watch. Is that situation under control, and do we know exactly how many cases are there now?
Julie, can you take that question?
The status of that particular outbreak in Regina is one that we can check back, and we can connect you with the local medical health officer in Regina and public health team that's managing that outbreak to answer those questions.
I think that's everything. Thank you, everyone.